Hi, I'm Dr. Fareeha Rizvi. I'm a consultant in endocrinology, diabetes and general internal medicine, and I'm head of department, so I'm head of diabetes and endocrinology at my hospital, which is part of a big university teaching hospital trust. Well, I come from a long line of doctors, so my parents are both in the medical field. My dad is a consultant surgeon. My mum is involved with training doctors and nurses, and all of my younger siblings are doctors. I have a few uncles and aunts that are also doctors, so I guess you could say it's a family tradition, but also basically since I was very little, I wanted to become a doctor, and I think I have no other skills apart from being a good doctor. So I did endocrinology and diabetes as a junior doctor at a busy district general hospital, also near to where I currently work. And it was really just the interaction of endocrinologists and diabetes specialists with their patients. So it's a non-surgical speciality, and it's really based on developing like really good communication with your patients, taking a really good history, a really good back and forth. And the thing with endocrinology and diabetes is, no detail is too much. So we want to know in our specialty, we want to know everything. We want to know about your sleep cycles, your eating, your exercise, your mood. So that's what's really special about diabetes and endocrinology. It's not like other specialities, like surgical specialities, or even some other medical specialities where these lifestyle things don't matter as much. So that's my favorite part, actually, of my specialty, is getting to know my patients in terms of them as a human being and their lives and their routines. That's my favorite part of my specialty, definitely. So again, it leads on, I suppose, from the last question, is really getting to know people, getting to know my patients and having a long-term relationship with them. As you know, type 1 diabetes, for example, that I do, that's not a reversible condition. So people will have that lifelong. And through my career, I've been able to build up really long-term relationships with my patients with type 1 diabetes, particularly. Some of the women that I look after, for example, I've looked after them before they've had their baby, during their pregnancy, and then I get to go and see them when they've had their baby, and then I get to see them a few months after delivery. So that sort of thing is really rewarding, and it's really unique to my speciality. The other thing that I'm interested in is type 2 diabetes and pre-diabetes, particularly in the South Asian population, but really, anyone with pre-diabetes or type 2 diabetes. And again, I'm really interested in people's diet and lifestyle, and the way that modern life and our modern routines affect our health. And I see a lot of interplay about that in all of those areas in East London, or London, or any big urban environment, how living in a big urban environment impacts our health. So those things are kind of what inspire me most about my speciality, and particularly my patients that I look after. So like I said before, I think I value people as individuals. I don't see them just as a name or a hospital number. I can understand how difficult it can be to live with type 1 diabetes or type 2 diabetes or pre-diabetes or any other long-term hormone condition. So I never want patients to feel as if they can't talk to me or they can't open up to me. I hope that they value my empathy and compassion. I always try and go over and above for my patients. So if they need, a more detailed letter for work, or if they need a bit more support in terms of social care, I'm always happy to have meetings with their GPs or write the appropriate letter where appropriate to get them a bit more extra help. So that's what I think patients value, is that they have a point of contact in me where I really do try and make a difference to other areas of their life, not just their kind of physical health. I guess I'd say something like, we all need to live our purpose. So we all need to find our purpose in life. And it's really easy to give up if you make healthy lifestyle changes. It's really easy to fall off the bandwagon or get on the bandwagon, particularly at the beginning of the year. Every new year, I see patients making changes to their diet and lifestyle, and then giving up a few weeks and months later. So what I want people to do is find their purpose and find what inspires them about keeping healthy and staying healthy, and how to make small changes along the way. So you don't have to make dramatic changes, but if you can find one thing that will resonate with you in terms of your health, whether that's giving up a particular type of food or taking up exercise, those are the things that that's the way I live my life, and those are the things I try and communicate with my patients. So I have seen thousands of patients with diabetes over my career, and diabetes medicine and treatment has come a long way in the last 10 years or so, where previously people with pre-diabetes or type 2 diabetes were just put straight onto medication. But there's been a lot of research which has identified the need to reverse pre-diabetes and type 2 diabetes, and to really change the approach that we have when it's first diagnosed. And that's where a big aspect of my interest lies. I don't want people to have a lifelong chronic disease such as type 2 diabetes, and where it's reversible in the appropriate people, then intensive diet and lifestyle change, along with support from a specialist like me and the rest of my team, can really make all the difference. And you can get rid of this chronic condition, maybe not permanently in all cases, but you can certainly get rid of it even for a few years. And if you can get rid of it for a few years, then that is a bonus, and that is a few years lived with better health. And there's been a big move to treat pre-diabetes or type 2 diabetes a little bit in the way that we treat cancer. So when someone's first diagnosed with cancer, we try really aggressively to achieve remission, so to get rid of the cancer, by all means necessary. So surgery, chemotherapy, radiotherapy, whatever it is. And the same approach is now being adopted to pre-diabetes and type 2 diabetes, to get rid of it early, and then hopefully have a healthy few extra years of your life lived in good health. Because the longer you live with type 2 diabetes in particular, the more risk you are at developing things like heart disease, stroke, leg amputation, eye disease, nerve disease, and kidney disease. So for the motivated people that have their yearly blood test, that are interested in making a change, pre-diabetes particularly, and type 2 diabetes reversal is absolutely possible, given all the evidence that we have now.